Okay, I am with Joy Rodriguez, who is on Oahu in Hawaii, and she's going to tell us a little bit about how medical aid in dying is handled in Hawaii. So, can you tell us a little bit about that, Joy?
Absolutely. Hi, I'm Joy Rodriguez from Burden Lifters here in Honolulu, Hawaii. And I'm an end of life doula that services all of Hawaii, but mainly the island of Oahu. And here on Oahu in particular, we have a fabulous team that works on medical aid in dying. So there's three different ways of getting medical care here, excuse me, here in Hawaii. There's private hospitals, and there's a handful of them, but the majority, about 80% of the population here, either associate with Hawaii Pacific Health or Kaiser. So if you're with a private hospital, you want to get in touch with someone like me, Joy Rodriguez, Burden Lifters, to help you through the process. But if you are with Kaiser or with Hawaii Pacific Health, they both have two advanced care coordinators that are awesome. And if you are interested in doing medical aid in dying and you qualify under the law, then they will help you through the process and they will hold your hand. They will help you get doctors. So here in Hawaii, you need the attending physician, the consulting physician, and you need a psychiatry or social worker sign off. And you have a 20-day wait between the first oral request and the second oral request. So there's things, and you have to do a final attestation. So there's things that, and written requests. So there's things that need to happen that are cumbersome. But those two organizations will help you walk your way through it. So once you express your desire to your primary care physician, they will refer you over to those advanced care coordinators. Those two wonderful women will walk you through from start to finish, making your appointments with your two physicians, making your appointments with your psychiatrist, helping you get your prescriptions over to the pharmacy. And here in Hawaii, Medicaid covers the cost. So
That's
the
phenomenal.
entirety, it's wonderful. So the entirety of your cost for your medical aid in dying, which should be covered under your insurance.
Just a few days ago, I sat in on a call that was hosted, if I'm remembering, it was Compassion and Choices and End of Life Washington. And they were talking, I think it was a woman from, was it Georgia? I think Georgia is entertaining the passage of medically assisted dying. And they were talking about the importance of collapsing that 20-day wait. So I think they had that in certain cases, they were asking for there to be a workaround to collapse it down to a 48-hour wait.
Like they were able to do in California.
Yeah.
And New Mexico.
Yeah. So that's
that would
phenomenal.
Be wonderful. Yes. Yeah. And Compassion and Choices, which is a nonprofit that works on the legislative path to try and get medical aid in dying legal and normalized. They are working, they have a really strong push to get APs, also the APRNs, did I say that right?
Yes.
Nurse practitioners, because right now, as far as I know, no states allow nurse practitioners to sign. It always has to be an MD that signs. So that would be huge.
Will the MD sign it at the request of the nurse practitioner? Or does the
I think it really depends on the MD and the relationship with the nurse practitioner, because they need to be responsible for your care or for the care of the patient, right? So that's the dynamic between those individuals. As far as I know, their hands are not tied by the law in that regard. However, we still need that MD signature. And
Right.
so for people that live in outlying areas, particularly here where we have, seven islands, and most of the medical care is centralized over here in Oahu, these people on the outlying islands really have a problem with access of care. And
Right.
so to be
Right.
able to have APRN sign, big deal. It would be a big deal, and it would really help access care.
And so I know I mentioned to you earlier in our conversation that here in Washington State, in Seattle, that more and more the hospitals are becoming affiliated or owned by or influenced by Catholic hospitals. So say again what you said about religious, say hospice, Catholic hospice, or that doesn't impact people having access to medical aid in dying.
Just so blown away and impressed by the hospices here in Hawaii. It's just amazing. So there's several of them that actively support medical aid in dying, and there's a couple of them whose medical directors will sign as a consulting physician. However, there's several of them that, due to their moral stance, they do not support medical aid in dying. But here in Hawaii, what that means is they are not allowed to be in the room with the patient when they are using their medical aid in dying medication. So these hospice companies will still support their clients. So they'll refer out, they'll say, I'm sorry, I cannot help you to do this, but let me give you the name of someone who will. So I've gotten referrals from people in these organizations that said, oh, I can't help you with that, but I know Joy would be able to help you.
Right.
And so I've gotten referrals. And so then I can then go reach out and find my doctor network, or connect with Compassion and Choices, or connect with Hawaii Pacific Health or Kaiser, and talk to them and help those individuals so they're not alone. So they are never held like at a stopping block. And then when they need things like their attending physician needs to see their medical records, these hospices don't block. They're like, of course, where do I email it to? Have you filled out the correct form? Let me email over your medical records. There's no blocking involved.
Yeah.
They're very helpful.
So Kaiser, so back up. I know that here in Washington, that we had a situation with a woman here in our community who had MS and was in an assisted living facility for over 15 years. Even though cannabis is legal use here in Washington, because the facility, because of the facility she was in, we weren't supposed to be able to take cannabis into her. But with her MS, when she used cannabis, her hands, from this position, her hands would relax enough that we could file her fingernails and wash under her arms and just give her quality of care. So we had to do that on the down low because it was a federally funded facility. It also meant that when she opted to utilize the Death with Dignity medical aid in dying, we had to remove her from that setting, which she didn't mind at all to be able to do that. But it meant that we had to remove her from that facility in order for her to follow through. Now, Kaiser is the same thing. I have known of situations where patients in California have requested, how about me using cannabis rather than opioids? And they would say, well, if we find cannabis in your system, then we're going to not give you the opioids. So it was an either or. It wasn't a support because it was a federally funded facility. So how does Kaiser in Hawaii, they are federally funded, right?
I'm not super familiar with the ins and outs of Kaiser. I haven't worked a whole lot with them,
Yeah.
because they're able to take care of their own. Really,
Right.
like if you look at our numbers for medical aid in dying, here in Hawaii, about 40% of them are Kaiser patients. So
Wow.
now remember, Hawaii only passed legislation in
It,
2019. So we're very new numbers, very low numbers because, we
right.
just haven't been
Right.
around much.
Well,
Um,
and those states that are now honoring that or putting medical aid to dying into law have learned
mhm.
from other states that are still
Yes,
operating by their restrictions.
yes,
So, little by little, it hopefully gets better and better and easier. So,
yes. So I can't speak to the marijuana issue because pokololo here is still illegal.
uh-huh.
But I think it is legal for medical. But from what I hear, the medical grade is highly regulated to a point where
Yes.
it's not very effective.
Yeah.
Um, so so I can't speak to the pokololo because
Yeah. Yeah. Well, well,
but
I'm just grateful. Go ahead, Joy.
no, but I think as far as things that are legal, uh, my experience has been, regardless of people's personal preference, everyone across the board has been very supportive.
Yeah. Yeah.
And I did have a client that had to transfer out of a facility because the facility didn't allow medical aid in
Yeah.
dying, and it was handled wonderfully. And the people at the facility, gave her support, love, and attention. Did not penalize her for her
Right.
choices,
Right.
and she in turn was upfront about what was going on. There wasn't a lot of there was some family dynamic, but as far as her honesty to the facility that she was housed at, there was a lot of mutual respect, and
Yes.
it was
Yes.
it was just really it was a great thing for her. She was able to come home and die at home.
Yeah. Compassionately and professionally, it was handled
Yeah.
well. That's
Yes.
wonderful. Well, thank you for this because it was so contrary. The information was so contrary to what uh, in some situations we're
Yeah.
experiencing here.
Yeah.
So hang on so you and I can talk, but I'm going to end our recording. Thank you so much, Joy.
No problem. Thank you for allowing me to share, Rhonda.
Yeah, and tell people again how they can reach you.
Oh, Burden Lifters here in Honolulu. So I'm at www.honoluludeathdoula.com.
Great. Thank you very, very much.